Hello, and welcome to Healthy Living. I'm Dr. Pelto, and today we're going to talk about everything that you need to know about when you're having foot surgery. So this is a discussion that I actually have with each of my patients before they go into surgery to discuss the common questions and the concerns that they have. So let's get started here and look at the first question. The first thing we want to look at is really what are some of the non-surgical treatments that you've had. So for example, if you're dealing with a bunion or a hammer toe, have you tried wider shoes? Have you tried using different types of pads or trimming down calluses? And then based on those treatments, what's worked, what didn't work, and really are there any other possibilities to avoid surgery? Because surgery is always a last result. There are other things that you could do, but many times you don't want to rush into things. So you want to try different types of pads, different types of treatments that can be used, and look kind of what worked and what didn't in any other ways. If you've got to a point with your foot where there's really nothing else that you could do, then it's time to consider surgery. The next thing you have to look at is it's always good to look at some type of additional imaging. And one of the most common type of images we use are x-rays. And look at the condition that you have. You should look at this thoroughly with your foot and ankle surgeon to see what are the problems that you're dealing with and how they're going to be corrected. And many times you want to see, is an MRI needed? Is it indicated? Many times MRIs are indicated if you have a tendon injury or something else that's a soft tissue injury. And it's also good prior to your surgery to review the MRI results with your doctor. Another type of technology that can be used as well is called an ultrasound, and sometimes that can be used prior to surgery. And the next thing I want to go over is really a laundry list of some of the most common questions that patients ask about their surgery. And it's good for you to know, first, how long is the incision going to be? How many incisions are there going to be on your foot? Where they're going to be at? How long will the surgery itself take? Is the surgery going to take a half an hour? Is it going to take 3 hours? Will you have to stay overnight at the hospital? And then one of the most important questions I feel is that how long is your recovery? Because if you're looking at a surgery where you're breaking the bone and putting a pin in the bone or a screw, it may take 6 to 8 weeks. If you're doing a fusion of a joint or putting a joint together to not move anymore, it may take up to 3 months. But what will the practical time to get back to your activities take? Will it take 3 months or 6 months? Those are things that you need to know prior to your foot surgery. And then with your foot surgery, will you be able to be working or will you be off of work? For certain types of surgeries where you can't stand on the ground or you have to be in a cast or use crutches, you may not be able to go to work for a period of 4 to 6 weeks or even longer. And then when you do go back to get that cast off or that special boot, when can you start walking? And then when can you start working out? Will this come back? That's a big question in terms of how you correct something. Sometimes there's a simpler type of a procedure. I'll give you one example. Sometimes with a hammer toe procedure where you have a curved toe, you can actually take a little bit of the bone out and then just leave it like that, but there's a chance that that could come back. Whereas if you fix the tendon here and if you pin the toe and do a more involved procedure that might take a little bit longer, there's less of a chance for it to come back. And then some other questions that patients have are what type of medications do I need to stop before surgery? Should you stop Motrin, Tylenol, aspirin, Coumadin, which is a blood thinner, any steroids? And then the last question we need to be aware of is, do you already take any narcotics or pain medication? So narcotics are used for a lot of other conditions. They can be used for different types of arthritises, knee pain, back pain, and chronic pain issues. And if you're on already a narcotic, you may respond differently to the medications after surgery. We're going to spend a little time to look at some of the blood thinners that can happen. So here you see some of the blood thinners. You have warfarin, you have Lovenox, you have Plavix, you have aspirin that's going to kind of stop you from or cause you to bleed a little bit more, and then some anti-inflammatories. My normal recommendation is that about 1 week you should stop the aspirin and anti-inflammatories and some of these other things. Now you need to talk with your doctor if you should stop the Coumadin or the Lovenox if you're taking it, because for many patients with an elective foot surgery you can just remain on that because there's not too much bleeding, because something called a tourniquet is used during surgery. A tourniquet is something that actually cuts off the blood flow temporarily to allow you to do the surgery. Let's go and talk a little bit about what's going to happen now right before the surgery. So everything that's kind of leading up to the surgical event. You're going to have a visit with a preoperative visit with your doctor or at the hospital. And it depends. If you're at a surgery center or if you're at a hospital, you may have to go there, or they could do it over the phone. A big question that I think it's funny is, how about nail polish right up here? Nail polish, for some procedures it can stay on, for some they can take it off. It's always important as well to arrange for a ride to surgery. Just remember, you can't drive home afterwards. And one of the biggest reasons that people get surgery canceled is because they drink something after midnight. At our institution, the hospital is going to call the afternoon before surgery. So if your surgery, for example, is on a Wednesday, the surgery they'll call you Tuesday afternoon, and they'll let you know the time to arrive. Usually it's about an hour and a half before, and then before the actual operating time. And then in some places you'll be getting a walking boot or a shower cover, and we'll go over that in a little bit. And then also there are certain considerations that you have if you're a child. We'll talk about that as well. So let's look at during this procedure. So you've already got to the hospital now, and at surgery, what you're going to do, you're going to get there about an hour before, like we talked about. Children and diabetics, they usually go first, okay, first part of the day. You're going to get there, change your clothes. I always explain to patients, you are going to get IV antibiotics prior to the surgery, but unless you have an infection, you're not going to get any antibiotics afterwards, okay? So the IV antibiotics are needed before, but for clean surgery, you don't normally need any antibiotics. And then what you're going to have to do is a lot of paperwork. If you are a child, or if you're with your child, many times you're going to have some special work with the IV that's going to be put in, so they're not going to have pain. And also there's a special bunny suit, we call it, so you can go back into the operative room with your patient or with your son or daughter. Now we're going to look a little bit about the questions about anesthesia. And there are a couple of different types that can be done. The most common is called monitored anesthesia care. And basically what monitored anesthesia care is, it's this type of anesthesia that you have for a colonoscopy, where they put a little something in your throat to hold open your airway. But if you really can't tolerate that, then you're going to have general anesthesia. If you have any anxiety, they're going to give you some medications, or if you have nausea, and that's going to be helping if you're anxious. And then we're also going to look at what type of anesthetic block that you're going to get. You'll see here a couple of pictures. Here is a picture of a foot, and typically what we do for example, a bunion is we put some medicine around here, all the way around the big toe joint to numb everything up. If we're doing the hammer toes, then we're going to inject in this area. Now for bigger surgeries, we actually go down and we do an injection in the back of the knee. The anesthesiologist does that to numb all those nerves that are going down all the way down to the foot. So that's the type of anesthesia. Usually it's a combination of anesthesia that you get from an anesthesiologist, but also lidocaine and marcaine that we put in the foot to numb it up. And the reason we do that is if we can numb the foot, or you can numb behind the knee, that means that you don't have to use as much anesthesia to keep the patient asleep, because they can be sleeping easier because they're not feeling any of the pain because of that Novocaine that's been working. It's kind of something unique I want to talk quickly about is a pre-surgical kit, and I did bring one of these to show you. So this is a little pre-surgical kit that a lot of the patients will get. Not everyone needs it, but basically there's 3 different components. There's a surgical site prevention, infection prevention site, an incision care, and then post-operative pain and inflammation care. So let me go over that. I brought this little kit with me today to show you, and it's actually a kit that a lot of the patients get in the office. It starts with a little bit of an introduction letter that you're going to get, something like this, and then you're going to get some information about the pharmacy. And it has all the instructions that you need right here, and there's different sections in the box, and the box also has these different sections. The 3 sections are infection protection, incision site care, and then pain and inflammation. Now, why do we use these? A lot of patients, they come in and they have a difficulty during the surgery. They want to make sure they're doing everything possible to prevent any type of an infection. And that's where, for certain types of our patients, depending on insurance, we offer these. So let's first look here. In this first section is section A. What they have here is something called Mupirocin, okay? What this is used for is actually if you've had a history of methicillin-resistant Staph aureus, this can actually be used as a nasal swab in your nose to kind of reduce any of that colony of the bad infection that can sometimes happen. And then what this other component is something called Hibiclens. Hibiclens is a very potent wash that you can wash for the first couple of days prior to the surgery. So you can kind of clean that for the 2 days prior to surgery, a nice foot scrub that's going to help everything, kind of help prevent infection to the best of our abilities. Once the surgery is done, before you can do anything else, you really have to wait for that skin to heal. And skin heals in different speeds. For most patients, it's between 10 and 14 days when we take out the stitches. Once we take out the stitches, then we start working on the incision site. So there are a few things that can be used. Not everyone needs everything, okay? One of the things, here's a diclofenac sodium, which is something that can be used to reduce the inflammation of the skin. What you see here is a kind of a lidocaine cream. Lidocaine, once again, is a numbing agent. And there's some other types of things that can be used. And these things are used to help with the pain and inflammation afterwards. So this is after the surgery. If you're still having pain, you can use these to reduce the pain temporarily. Now, the last one is actually in this bigger area right here, is probably the most important for most people. And that is how to take care of the incision so it doesn't get a very large scar, a very inflamed scar, and have difficulties once you have a scar on there. And the three things that are in here are a steroid cream, and this cream can be used on the skin around the incision, and this can reduce any of the inflammation and kind of irritation that you can have on that. Areas of redness, inflammation, this can be used on that. There's also something else, it's called dimethicone. It's a moisture barrier cream. And this type of a cream, once again, can be used around the skin, all around your foot, because if you have a lot of swelling, what's going to happen is that skin is going to kind of slough off, and this is going to be a very good cream to help that. And then the third thing is an actual piece of tape here. And you wonder, why are you putting tape? Well, this tape actually goes right on your incision, okay? And you pull it off and you put it on top of this incision. It's actually a silicone tape. And we know, research shows that silicone can reduce kind of thick and painful scarring. So this is called this post-op kit. For some of the patients, you'll be getting something like that to help you during the surgical recovery, okay? Now, something else kind of unique for certain patients, it's not for everyone. This is called cold therapy. Okay, it's actually a combination of cold therapy and DVT, which means deep vein thrombosis prophylaxis. So look at this here. This is something that is used actually underneath a cast. If you put a cast on, this type of a device goes underneath the cast. These two little tubes hooks up to cold water, and it kind of puts cold water underneath there. This is something that actually goes over your dressing. So you have your dressing on your foot, and it actually goes over the top of it, and it allows this cold water to go in there. And both of these are used not for every patient, but the purpose is to reduce the swelling, reduce the inflammation, and reduce the pain. The cold is a very good way of reducing that pain without taking as much narcotics or as many pain medications. I want to give you a little example of what your foot will probably look like if you don't have a cast on your foot. Okay, the first picture with a smiley face is what a typical bunion looks like. And the other example right here is what something like a posterior splint looks like. This is something, it's made out of plaster, and it's going to stabilize your foot. If you need that stability, that's more common with a tendon type of a surgery or a bigger type of a surgery where you're fusing a joint in the foot. And then after surgery, everyone wonders what's going to happen, okay? You're going to have to go home, you're going to have to rest and relax, you'll be getting a special shoe or a walking device, and there's a plethora of things that you can use. And I want to go over a little bit of what these are. So this one on the bottom right-hand corner is a surgical shoe right over here. This shoe a lot of people get after surgery, and then when they come to the office, we switch into one of these post-op boots. It's called a post-op shoe. Now, if you need one of these other devices like a wheelchair or a walker or one of these scooters, you need to get a prescription prior because these are done through a medical supply store. Everyone that needs to stay off their foot, they'll get crutches the day of surgery. Now, if you need one of these things, you can order them online, and there's a kind of a competitor. This is something else. It's called an iWalk, and basically what this is something that looks like a little peg leg, and that can be used instead of crutches. So for someone that needs to be off of their foot, let's say for 6 to 8 weeks after surgery, it might be easier to get one of those rollers or one of those peg legs to get you around. It's very, very helpful, and it makes things a lot easier for recovery. Now, there's something kind of unique that happens when you've been wearing a boot for a long time, one of those walking boots, is that you're going to notice, unless you wear a heel on the other side, you're going to start getting back pain. And many people come in, they complain if they've been wearing this boot for a long time, they have this back pain. That's why there's something that was invented. It's called an even up. And here you can see a picture of the even up right here. This is attached to the shoe, and it adds a little portion like this to make the boot the same height as the shoe. Do you see that? And so that's going to alleviate any of the back pain that you may have after your surgery. So a quick little review about pain medication. The way to reduce pain medication is really to rest, sleep, don't walk, and elevate your foot. And we want to talk a little bit about some of the pain medication that can be taken. And this is a big concern because we don't want to give you too much and we want you to be comfortable. And in this day and age, we're trying to reduce the amount of narcotics that people are getting, and that's why these cooling systems are helpful, keeping your foot up and elevated to reduce the swelling, and really being careful and having meticulous surgery is important. But if you do need a pain medication, the typical ones and the combinations are kind of listed here. So let's go over them. The first one right here is called Percocet, which is a combination of oxycodone and acetaminophen. And this is taken every 4 to 6 hours, okay? And you can take 2 pills every 4 to 6 hours initially. Another type is called Vicodin, which is hydrocodone, and this can be taken in the same way. Now, both of these medications, both Percocet and Vicodin, they can cause some nausea. And for some of my patients, I give Vistaril, which is hydroxyzine, and this is an anti-nausea medication. You take it with the other medications that can help. And then as well, Motrin can be very helpful to reduce the inflammation and also can reduce the amount of narcotics. And then the last thing, if you have a cast on, a lot of our patients are going to get Lovenox, which is an anticoagulant. There are some other ones, and this one requires a daily injection. And there are some other types as well. But the main key is that the more you walk or the more you have your foot down, the more pain you will have. And I always kind of keep it simple for my patients. The first 3 days after a foot surgery tends to be the worst. So you're going to have to take more of the medication for that treatment. So that's the period of the surgery, and a few things to remember after surgery, just basic things to think about. How are you going to get to the fridge? And how are you going to get to the bathroom? It's very important that you have crutches or a knee roller or a wheelchair or something, okay? Who's going to be there for company? Okay, you have to have someone that's going to be there. And you want to shower, but you want to keep the dressing dry. So this is an example of a shower cover that can be used. That's very important. And then also I want to remind you, don't drive with pain medication. For example, if you get your left foot done, you can still drive, but don't drive with it and keep your foot ice and elevated. I want to show you, I did bring an example of this shower cover here. This is one type that we use. Basically, it has this plastic bag right here, and it has this opening, and you stretch it out and you put it over your cast or over your foot with the dressing, and you kind of pull it up right below your knee, and that's going to keep out the water. Okay, I would recommend getting one of these prior to surgery, and I also recommend that you try playing with it and testing it when you're not on pain medication. So get it before the surgery and then try it and see how it works. After the surgery, you're going to have different types of visits. Okay, so on the surgery day, you're going to be going home about 2 hours afterwards. Okay, at about 2 to 5 days, you're going to have a bandage change in the office. Sometimes we go up to 2 weeks, and that's fine, because the next time you need to be seen is to remove the stitches at 2 weeks. If you think you're going to have pain, I would take some pain medication, okay? And then at that time, if indicated, you can start some physical therapy. If there wasn't a bone surgery, right? If it was only a tendon surgery, sometimes you can start some passive movement. And then basically it's at 4 weeks and 6 weeks and then 8 weeks, you're going to get x-rays and see how things are doing. Usually at 6 to 8 weeks, the bone is starting to heal. Okay. Now, some important questions I keep in mind with all of my patients, and these are important to think of before. So, was this caused by any nerve injury or injury in general? Because you need to know that, because a lot of times some trauma can have nerve indications and complications with it. Do you smoke? Smoking can slow skin healing, it can slow bone healing, and I recommend stopping a couple of weeks prior, or at least greatly reducing. Also, do you have diabetes, and how is your blood sugar? Okay, so the blood sugar is called your A1C. You want to evaluate that. If your blood sugar is elevated or your hemoglobin A1C is elevated, you should probably delay surgery until your blood sugar is more under control. Do you have any history of heart problems? Heart problems are a risk for surgery, not so much for the foot surgery, but for example, for the anesthesia that you need to go under and for the recovery. And then also, do you have a history of any fibromyalgia? Fibromyalgia is a chronic pain problem, and if you have that, many times we have to alter the amount of pain medication that we give you after the surgery. Have you ever had a blood clot or deep vein thrombosis? That's important because you're at greater risk of having another blood clot if you've had one. And then, do you use a CPAP machine to sleep due to sleep apnea? And have you had a history of methicillin-resistant Staph aureus? If you've had a history of that type of skin infection, we have to take greater care in the future. And now I want to go over something that no one ever likes to talk about, but I think it's really important. If you're having any type of an elective foot surgery, isn't a comprehensive list, but these are some of the complications that can happen, and then some of the treatments. Okay. So basically, to start out, if you have an infection, that's one thing that can happen. We would give you an antibiotic. If you develop a blood clot, we would give you a blood thinner. If you have loss of circulation or gangrene, then that would require further surgery and maybe even amputation. These are things that can happen with foot surgery. If you have slow healing of bone, you may need additional surgery or a bone stimulator. If you have swelling, you may need a cortisone injection to get down some of the swelling or compression. And then if you have a big, thick scar, you see this keloid scar, that's what we talked about, that silicone tape, to help avoid that. Okay, there are some laser treatments and different types of creams that can happen. Here's an example of a blood clot. Okay. Some other things to think about, complications that can happen are recurrence. Now, if you have a recurrence, the problem comes back, you may need revision surgery. If you have loss of blood supply to the bone, you may need revision surgery. If there's overcorrection of the problem or a prominent screw or stiffness, all of these can be problems with this. And then also, no toe purchase. What I mean by that is, if you look at this picture right here, you see that toe is kind of cocked up. So any of this toe or some of these other toes, they can sometimes be elevated after a surgery. You could have weight transfer problems. You might need an orthotic. And then here's an example of all the nerves in the foot. So wherever you're doing surgery, there's a nerve there. So one of the worst things that can happen, you could have numbness, tingling, pain, chronic pain, or RSD, which is a really kind of chronic pain problem. So what we've looked at today is a lot of the kind of the questions and the concerns, and to prep you for your type of a foot surgery. Some of these things may be done by your foot surgeon, others may not be done, but it's really good to have this understanding prior to your foot surgery. So hope this helped you. Thank you for watching Healthy Living.